Hello, viewers. You're welcome once again to our enlightenment program that seeks to enlighten you on issues that relate to your brain and spine health. My name is October Ekmene, consultant neurosurgeon with the University of Uyo Teaching Hospital in Uyo, Akwa State, Nigeria, and a lecturer with the University of Uyo. In my last video, I had given an overview of the causes of low back pain. And I had promised that in this next video, we are going to take each of those causes mentioned and address them in more detail. Today, we are looking at one of the causes, that is degenerative disc disease. Degenerative disc disease refers to spinal disc breakdown as a result of age-related wear and tear that results in the disc losing water content, also reduction in the height of the disc, all of this leading to instability of the spine within that region. And sometimes bulging of this disc may compress adjacent neural structures. All of this leading to pain in the lower region called the low back pain. This pain may initially be on and off, not very serious. Patients could get around with it, but may progress over time and become excruciating. Characteristically, this condition tends to cause chronic low back pain, which progressively worsens over time. The pain may radiate to the buttocks, may radiate to the thighs, to the groin, to the legs, and even to the feet. Patient sometimes describes it as a radiating pain that goes through the back of the thigh to the calf. It's called sciatica. And this pain may be worsened by movements, either as a result of lying in bed and trying to turn in bed, sitting, or standing. And indeed worsened by walking a certain distance. Patient notices that he or she, after walking 100 meters, 200 meters or more, they notice that their legs begin to wobble, begins to feel numb, and sometimes there may be pins and needle sensations, making it very uncomfortable. If patient doesn't sit down, that may cause the patient to fall. Sometimes the patient may have to lean over something, lean on the wall, bend over if a place to sit is not available, just to obtain some relief. Also, it can present with difficulty with walking. That is because of weakness of the muscles as a result of a progressive damage to the nerves from compression. It could also present with problems with controlling urine. Patient notices that if he has the urge to urinate, he has to run to the washroom. Otherwise, he can wet himself or she can wet herself. Also, they notice that they have chronic constipation, difficulty passing stool. Sometimes they go for days without being able to pass through. And sometimes the other extreme may occur, fecal incontinence, inability to control the urge to stool. Patients, particularly males, may also present with erectile dysfunction, poor erection, and may experience numbness in the lower extremities. These are all signs and symptoms that one must not trivialize when they happen. Patient needs to present as early as possible to the hospital and to see a doctor. The diagnosis is first clinical based on the symptoms and signs elicited, and also radiological investigation will be used to further hone down on the particular cause of this low back pain. your doctor would ask you to do an X-ray. And this X-ray may be a static X-ray where you are motionless, or a dynamic X-ray where you are supposed to bend forward while shooting it or lean backward. All of these is to decide whether your spine is unstable or whether there is some compression of the nerve roots, depending on what the cause of the low back pain is. Further investigations like a CT scan may be required, and even a magnetic resonance imaging, which is gold standard for analysis of causes of low back pain on the spine. When it is decided that you have degenerative disc disease, the first line of treatment is usually non-surgical. Because it is age-related, it may not require treatment. Just behavioral modifications, exercises, physiotherapy, use of braces, and other non-surgical measures can all help reduce the severity of the pain. Sometimes when these do not work, then injection called steroid injections can be done to the facet joint if that is the cause of the pain, or to the lumbar space itself, or even the disc. All of these are non-surgical procedures to ameliorate the pain. When the pain persists in spite of these conservative, non-operative measures, then, and particularly if there are signs and symptoms suggesting that the nerves and spinal cord are being compromised, then surgery becomes necessary. And in this instance, you need to see a spine surgeon, who could be an orthopedic surgeon or a neurosurgeon who is vast in the management of spine problems, in order for you to be properly diagnosed and treated. When these symptoms mentioned occur, it must not be trivialized. Otherwise, it can lead to serious disability. Patients can become wheelchair bound as a result of irreversible damage to the spinal nerves and spinal cord, resulting in paralysis. And so it's very important that this video is treated and taken seriously. You can share the video to your friend or anybody that you know may be passing through this problem. You can also click on the like if you think that it's useful, and you could also watch out for the next video as it comes. Thank you for your attention, and I look forward to seeing you in my next video.